We are. Lovely pieces. Okay, so continuing on. Okay, I had to make sure I wasn't going crazy here. I am under the Elder Care Development Partnership as a community developer through Arrowhead Area Agency on Aging. And part of what I do is provide technical assistance to aging service providers. So really anything they need, we can be a system for them. We can help identify some funding. We can help with board development. We can help find a speaker for if they have a training or a conference. Anything really they can think of, they can reach out to us, and we can help at the back end so that they can continue doing their services on the front end. Another part of that is community development, which I mentioned, and we take the gap areas and really see if we can help develop what's missing. So back when I started, we first were working on starting up Age Well Arrowhead, which is an exhibitor here today. They're in Duluth. And so my predecessor actually just started that agency through EDP and a grant that we applied for. So we can do a number of things, and we're really just meant to be helpful, supportive, and paying attention to those gap areas. And so something that we do in that work is help introduce new concepts or innovations, or see what other parts of the state are doing. Can it be replicable? And really just try to make connections. And that's where this came about. This is new for us, as we are the service providers. We don't do direct service. Our senior linkage line does, but the EDP does not. So we wanted to learn everything we could and then share it with anyone who wanted to hear it. So we have our three wonderful panelists here today that I consider experts that will share an array of information with you. I don't know why I have this because I'm not going off of it at all. I would love to have you all introduce yourselves and start there. But after that, really, we just want to open up a discussion and just make it a conversation. I do have questions where I can prompt if you don't have any, if you just want to listen and learn. But I am hoping that you come up with some and that we can give you the answers to your own questions. So let's start with some introductions. How about we'll start on this end with Diane.
Hi, Diane Prickett, and I'm with Minnesota Lifestyle Solutions, but I am also associated with Cardinal Comfort Care as their designated coordinator for 245D licensing in Minnesota. And we're the second co-op in Minnesota to get a license, but we're not operational yet. We're still doing the process. We got a piece of paper, that's all. A triumphant.
Yeah.
Oh, yeah.
A lot of work behind that.
A lot of work.
Well, it's good to meet everybody. I'm Electra Skrzydlewski. I'm the Director of Shared Ownership for a community development organization called the Metropolitan Consortium of Community Developers, or MCCD. And we are a technical assistance provider in much the same ways that area agency is. So really, I work with Diane and Susie to help build their businesses and make sure that it aligns with their values and the ways in which they want to serve the community.
I'm Susie Rosette. I'm the Executive Director and founder of Cardinal Comfort Care. You've seen us with our jackets around here, and we're very, very grateful to be here and to share in this experience of caregivers together. And that's all about what a cooperative is. It's about being together, engaging one another in the good work of taking care of people in their homes.
So I can kind of jump in a bit and tell you a bit about how MCCD came to work with Minnesota Lifestyle Solutions and Cardinal Comfort Care. It might be helpful to get some of that context. So it comes as probably no surprise to anybody who is in the caregiving field or is caregiving adjacent that this is a very difficult sector. And it's difficult for a wide range of reasons. And Minnesota has not been immune to that. And as we see this kind of growing need in the community where, baby boomers are some of them are approaching their senior years in volumes that we haven't seen happening all at once, really ever, right? They're an enormous generation. And with aging can tend to come the onset of one or more disabilities. It just really alters the kind of conditions surrounding someone's life. And the state of Minnesota, by virtue of not only the growing demand by changing demographics in our state, but also the fact that this is a tough field. So it is difficult to keep skilled, committed caregivers in the field with all of the various challenges that they experience on the job. The Department of Human Services had been experimenting with a broad range of different initiatives for a period of about 5 years. And by virtue of the COVID relief funding that came by way of the American Rescue Plan, the state of Minnesota's Department of Human Services created 4 different grant programs, really to help develop and strengthen the workforce in Minnesota so that we could start addressing some of these workforce shortage crisis issues in a very different way. And for the last 10, 11, 12 years, there has been an intentional effort around building employee-owned businesses with a focus on the direct care sector, primarily home care businesses, but Minnesota's shaking that up a little bit because we've got some different types of businesses that are in the direct care field. And essentially they took a pool of those grant funds and set them aside to help support new starts, expansions or conversions for employee-owned cooperatives or worker-owned businesses. And for folks who don't really know, what is a cooperative? What does that mean? It means that it is a company. So these are for-profit enterprises, right? So it's a company that is created and controlled by the people who benefit, right? Who use it. So in this case, it is created and controlled by the workers who benefit directly from being involved in the enterprise. And what that means is that those workers come together and they typically elect a board of directors. So it's a body of caregivers who come together to brainstorm, to think together, to dream together, to create the vision and the structure of the business together. And then kind of from the outside, it may look like a typical home care or direct care business because it still has a similar enough outward presenting structure where there may be fabulous management, lead administrators, and then a team of caregivers that are serving clients in the field, which also tend to be administrators that are out serving clients in the field. But one of the things that makes it different is that each one of those roles is defined in such a way that it also helps people understand their decision-making authority, like the scope of how they make decisions for the business. So instead of being one agency owner who is making all the decisions for the business, it brings in an element of democratic decision-making and participating in those decisions that affect the business. Everything from what's the name of our business to what is our pay structure and how do people benefit from being able to engage in profit sharing. So those are kind of like the big picture ideas of like what means a co-op. It means that the people that use it are the owners. In this case, they are the employees and the workforce. They come together to make democratic decisions, typically through a board structure. You can have whomever you choose on your board, but typically in this structure, it's a majority worker owners. And then third to that, they share in reaping the benefits of that business's success while also engaging in taking on the risk for the business. And at the same time, they do this in a way that suits their unique ideas for that business, right? So like some businesses will say, half of our profits, we're going to reinvest in the business. The other half gets divided among the member owners. Some are like, you know what? We have already built really strong reserves. So now we're going to go and just distribute patronage that way. So one of the things that you should walk away from this conversation understanding is that cooperatives afford the caregivers a lot of flexibility to decide how they want to work and how they want to do that together and what the benefits of being involved in that cooperative are going to be. So the state of Minnesota had a lot of foresight in being like, we've tried a lot of other things. Let's make an investment in a different area. And to go back to what I was saying about where this idea came from, but about 10, 11 years in the field testing it. So Cardinal Comfort Care and Minnesota Lifestyle Solutions now belong to a network of more than 20 worker-owned cooperatives that exist across the country. And the most fabulous thing about being a part of a movement to change the way that caregiving looks for workers and thus for communities is that they can learn together. They can grow together. They can learn from each other's experiences and knowledge. And what are you trying? How are you growing? What, did you experience this when you were new at a startup? And so much so that every year, similar to what you're all experiencing in this conference, there is an annual caregiver conference. But this one's super awesome, extra awesome, really, because it brings together worker-owned businesses exclusively, right? So like, because they have this very distinctive business model, there are different challenges, right? Different roses and different thorns that come up. So, that's one of the ways that you can kind of think about it. And I've had the good fortune of, knowing these fabulous caregivers, from different places in their journey to where we sit before you today. And, I'm excited for you to hear a little bit about what's been like.
Yeah, I think that'd be a perfect spot if you wanted to take turns telling a little bit of your story and how you got into the work, because I believe both of you were doing that direct service work in a different capacity before. So I'll let you decide who can go first, and then maybe just share a little bit of your story.
You want me to go? Sure. Okay. Well, I'm Susie Rosette. Thanks for coming to our little session here, our breakout session. We started out as basically it was my husband and myself. We did hospice for about 14 years, and it was all private pay hospice. And so I had been in the field working as a PCA, hospice, all the direct service kinds of jobs in my careers. And through that experience, what I started to see is a big gap in how the end of life was looking for people. So I saw that people that had lots of money were dying very well, and people that didn't have money were dying very poorly, or they didn't even have anybody with them, So that was kind of breaking my heart. And I decided, in order to make a change in this, I need to apply for a 245D license so that we can serve people on Medicare and Medicaid. So that's what I did. And during that time that we were waiting for our license to come through, there was a grant that came up through DHS. And that grant was for direct care workers to start their own cooperatives. And I thought, that sounds really interesting. So I applied for it and got it. And thus I met Electra, who is part of that whole deed process, and with MCCD, who is the company that she works for, who manages the grant that we got from the state of Minnesota. Got to meet her and got introduced to this concept of actually creating and building a cooperative. And I didn't know anything about it. I had no clue what I was doing. One thing I can tell you is that there was quite a bit of training in the beginning. There continues to be training all the time. We're still little babies in this whole cooperative thing. But the more I got to know about how it's structured and what it can do for the workers, the more I got intrigued, and the more I got kind of a little gumption under my belt that said, you know what, this is something that can work, because we're not, usually people that are in direct support services are not treated the best, not paid the best, not acknowledged. And that really bothered me. Number one, because I am one. And number two, because of the work that's actually being done and the investment that we make you know, physically, spiritually, emotionally with our clients is at a level that isn't like anything else, you know? And not saying anything bad about any other care levels, you know, nurses, LPNs, doctors. But let's face it, it all runs you know where, downhill. And, but there's so much honor in that work and so much dignity in that work when, you know, you have it as a career that it's hard to get treated that way sometimes. And I like the idea that cooperative would empower the people that are working for it. So that's how we got started. And we got our license in November of last year. We've been launching, and it's just been kind of, it all ran out of my house and office. And when it got to the place where there was maybe like 17 different people coming in, it was time to move into an office space. And so we just did that at the on the 1st of May. We got our own office in Two Harbors, and yeah, that was a big thing. And yeah, so through that whole thing and talking about cooperatives is we had to find somebody that had a degree in social services or human services to be your designated coordinator. And so then I started this search, right? Oh, I need to find this needle in a haystack that wants to do this cooperative and work with us. And it just so happened that Diane was in the cohort also with her own cooperative in St. Cloud called Minnesota Lifestyle Solutions. And we kind of hit it off at the conference, at this really great conference in Washington, DC, when we went. And so I asked her if she would consider that, being a designated coordinator for both of us, because we both have the same mission, and she basically would have the same, you know, position in both companies. And she said yes. And so we've been together ever since. And so she helped us at a time that we needed that. And then it's now come to pass now this year where, you know, there's concerns about licensing, and it's such a long process. It's like, I would say
2 years.
2 years for sure. And so she was starting to wonder if she was going to get her license. Because there's so many changes going on at DHS. And so she asked, well, what do you think about MLS coming under Cardinal until we can get our license? And so I was like, sure. You know, what other companies do you know that would just do that? You know, like have like a little mini merge, and then when she's ready, she can go off on Minnesota Lifestyle Solutions. But we know in the principles of cooperatives, there's 7 principles, and I can't run them off by heart. But one of them is
Number 6.
Number 6. And what is it?
Cooperative support cooperatives.
Oh, cooperative support cooperatives. And so I really feel that we're at the essence of that number 6.
Yeah.
And so at any rate, so right now we're now merged together fully. And since then we've got, I don't know how many already. How many employees we have together?
Oh, I don't know.
Yeah, together I think we have about 35 employees.
Yeah.
So that's like a burst. You know? So we're going through these small business bursts, growing pains bursts, whatever you want to call them. But it's still really exciting, and it's really fun to be able to help them and know that they're going to launch in St. Cloud pretty soon, and we're going to be a part of helping them do that. And it's just a really neat model, and I really appreciate everything I've learned. There's so much to learn about how they are governed, like she talked about boards and all that. And any one of our members can run for the board. Our employees are encouraged to come to board meetings. Everybody has a vote and a voice when they're a member. So, you know, they can make suggestions or, you know, they can help make decisions based on policy and procedures. You know, when you're in the field and you have like this idea and you're in like a real corporate kind of facility and you want to see something change, you can say it to somebody, but you have no idea where it went. You know, it could just go away. But here in a cooperative, you're gonna come to a meeting and people listen to you and maybe say, that sounds like a really good idea. Not only does it sound like a really good idea, but let's vote on this because we want to implement this into our procedures. That is the power of a cooperative to me, is really affecting the business in every way, shape, and form. So are there bumps? Yes, there are. Are there still HR problems? Yes, there are. We're caregivers, so a lot of times we're actually, I think, more often very kind and gracious to employee situations. And that part I do like. But, you know, it doesn't come without some of the tough stuff that goes along with business too. So, but it could not have been done had we not gotten a grant. I can tell you that. Because it does take a lot of time and it takes a lot of money. And, you know, together, we're doing it. We're doing it. And we're hopefully offering a solid solution for the state to look at and say, you know what? They really are making this happen, you know, out of little 2 harbors, Minnesota. So I hope that helps.
Yeah, I love that.
Yeah.
We'll go to Diane and tell her story a little, and then before I forget, I'd like to talk a little bit more about the types of supports after that.
Oh, sure.
Because I think in any line of work or business, sometimes we feel that you know what you know and you have to search for the rest. And so I think they have a lovely built-in support network in all different areas, whether it's financial or otherwise set up. So we'll have Diane speak a little bit to your story first.
Okay. I think the other amazing thing about cooperatives is that the members are business owners. That is so empowering. Not everybody will be able to ever think that I'm a business owner. And that what they say about running that business counts and that they're heard. So that's incredibly empowering. Our story is a little different. I have a team of people that I have worked with. I've been their supervisor for years, and they followed me through a couple of companies, but we were working for a company that was incredibly toxic. It was not a healthy environment. And I had had case managers who give us the referral to the scene saying, do I have to talk to the office? Can I just talk to you? It's like, just talk to me, bypass the business completely and just make things happen. And that's how bad it was. And the case managers came to me, counties, and said, why don't you just do this on your own day? And of course, I'm sitting there thinking, well, it's about work. I don't know. My team heard that and they said, you can do that? So we can do it. What? And they're like, how can we do that? And so they were looking to me to lead that. And what I actually did in the beginning, because I didn't know what direction we were going to do, I interviewed other companies, other small companies in our area. There were LLCs. They said, how did you decide to be an LLC? How did you decide to be an S Corp? And how do you run your meeting? They were very open and honest and willing to do that. And it was every single one of those people said, you want to line your own pocket, Diane? And I'm like, excuse me, I'm not doing this by myself. There's a whole bunch of us doing this. Why would I line my pocket and not theirs? And as we researched different business models, we came up with a cooperative concept and filed our business as a cooperative in February of 22. And then we applied for the grant, the 245D licensing. We'd already applied for that prior to that. And then one of our team members came across the grant. I was like, oh my gosh, this is amazing. Because honest to gosh, I was looking at how are we going to do payroll? How are we going to fund this thing? And I had a lot of people tell me, you can't be the sugar mama, you can't do this. And I'm like, what, I got a mortgage on my house? How are we going to get this started? Because it's just incredible. But we were honored by being selected to do this with this grant, and Electra's been amazing. And they're doing it. And it has been the toughest 2 years you can imagine. But we're out of that toxic environment. It got so bad that I researched again and I interviewed companies to hire us to hire the entire team and all the people that chose to follow us. And I found a company that would do that, and they took us all on in one big swoop. And plus, and I've had people follow me from 2014 through, now this is the fourth job, and they're just like, and the case managers are like, where are you working now, Diane? You know, and they're just following the whole team. It's just amazing. It's been amazing support. But it's an attestment. So we were fortunate to find this last company that we worked with. It was an LLC. They had the LLC mentality. There was like, you can't do training, it costs us money. You can't do shadowing. Shadowing is limited to like 30 minutes per person because it costs us money. And I'm like, how are you supposed to learn to do this job? How can we feel competent to do your job if it can't even? And then you're asking them to either not learn to do their job or learn to do their job off the pay. And that's not fair either. So we got our license for DHS in April. It's a piece of paper on the wall, means absolutely nothing, because now we can't use it or bill until we get what's called the UMPI number. That's the next stage. And that could take, who knows, months, whatever. But we were able, under the gracious guidance of Cardinal Comfort Care, to be able to get started under a cooperative where we can govern ourselves and make our own decisions. And I have a team of 12 employees now, and we have 32 people follow us from the last company. The company knew they were going to do that. They knew we were going for our license when they hired us. They knew all of us would be leaving, and they still took us on, and they still worked with us, which was amazing. It was just the minor clash of, they were just bottom line dollar focused. That was, and I get it, they're an LLC, you know? And so we graciously left them. We parted ways. It was very amicable. It was wonderful. And we had 32 people follow, and we're now 46 people that we support. And it hasn't even been a month, but 2 weeks, 3 weeks. It's been crazy to get that up and running. So yeah, and once we get our OP numbers, then we can graciously roll into MLS doing their own thing. Not that we will still need you for guidance and consulting, because you've been still done it. And I'm still there. So yeah, it's just been, the support's been amazing, and reaching out to other cooperatives and the conference, you get all of those healthcare cooperatives together. That is amazingly empowering. It is just, it's the most powerful thing ever to hear other people's stories, where they're coming from, how they're doing things. They're like, that's a really good idea. We could do that. If we get to the board, and the board's like, that's awesome. We should do that. So it's just been amazing. Everything from creating our own handbook. That's been our latest.
Yeah, our project. Yeah.
Our latest project is creating a very encompassing training handbook. What are we up to, like 60 pages or something, but you know, it's all in there. It's not just your standard little, but it's just been amazing. And the team is absolutely so excited and ready to make it happen. And I would not do it. I would not be here if it wasn't for the team of people that I have. So they're been amazing. That's our story, a little different angle.
One thing I wanted to punctuate in case Diane didn't make it clear was they've been building this business while working really full time for another company that was not aligned with who they were and who they wanted to be. On top of experiencing a number of administrative and kind of bureaucratic challenges with, you know, working with a state agency. So, I mean, the growth that they have experienced, right? The lessons they've learned, the things that they have endured.
Endured is the word.
Endured, right?
For sure, yeah.
Right. But there's a light at the end of the tunnel. Absolutely.
Yeah.
Absolutely. We're gonna get there.
You know,
Yeah. What kept me going is the workers.
Yeah.
Knowing
Yeah.
what could be. And there's many days of crying, not knowing what am I doing this for, kind of thing, you know, just like any other entrepreneur, you know, up at night and stuff, but you know, we're here today, and I'm really grateful for that, and I'm glad that you gave us an opportunity. We at Cardinal have received a grant from the Agency on Aging, and one of the reasons is because we are cooperative, so we're all focused on the worker, and that really aligns with a nonprofit too. So I really feel honored to be involved in, you know, activities here too with the agency.
Yeah, and so you receive Title III
Yeah.
Americans Act for transportation, correct?
Not for transportation,
Okay.
for homemaking.
Okay, yeah, so we allocate Title III Older Americans Act dollars. That would be Rebecca Sash and Gina Marsala, and they are our grant managers and contractors. And so we like to, like, our words are make friends and just try to see, because in the world of aging, there's so many things that can be encompassed into that. And we just try to make friends and meet as many folks as we can to see how we can collaborate or talk about our funding or just do a presentation together, if nothing else. And so it's wonderful that we've made new friends.
Yeah.
And you both spoke a lot about how this was completely new to you. You had never been a business owner or didn't really know the exact steps or where to start with certain things. So what kind of supports and other systems are set in place specifically, aside from the conference, which peer support means everything. You know, talk a little bit about the support you receive.
Well, there's a lot of different organizations that work to put that conference on. And I feel fortunate that I was able to go like early on and learning about cooperatives, because it gave me the juice, like a shot in the arm to go, wow, this is awesome. And then keep going, you know, like Mario Kart here. But I will tell you this, that the technical assistance, like, for example, at any given time, I have access to people that will help me with budgeting, people that will help me with advertising, people that will help me with, you know, writing a handbook or, really business plans. And, that's what that grant really has helped us do, is have a support team behind us. So it wasn't like us totally out here alone floating around. We had a whole team of people that were ready to say, okay, you know, maybe go this way, maybe, you know, do this or do that. So I never really felt alone, in like, here, you know, just go do it. I fortunately have had, you know, 40 years of entrepreneurship under my belt. So I did have administrative background, which has really helped me in this position. But, you know, I know that Diane has had tons and tons of, well, I shouldn't say that. Lots of years to build up her clientele. So basically, in working her butt off for the past whatever years, she has built these relationships, not only with her clients, but with her caseworkers, the county caseworkers, and advocating for people. And she basically created a business and just kind of lifted it out of the existing system, and then now is placing it into a cooperative, which I think is brilliant. So, yeah, I don't know if that answers your question. But I have to say it.
That's about right. Yeah, that's about right.
Anything else to add, or?
What was the question again?
About the support. You know, one of the things that intrigued me with my first kind of intro conversation with Electra and others was it just felt like there was no way you could fail at some point, you know, like it seemed like you're taken care of, and that everyone in the system, you know, all those who would go to the Caregiver conference together and all the peer supports, you know, even with the motto Cooperatives for Cooperatives, I maybe I'm wrong, that feels kind of new or maybe even innovative. It shouldn't be, but it feels that way, you know, that you have this A to Z structure that that you're willing to not handhold, but support the whole way through from that A to Z. And I just think of maybe in a restaurant, you know, maybe you get to a business decision, you don't know who to turn to, you know, or like, where does some direct service workers get their training for staff? What if you don't know where to look or how to afford it?
Right.
You know, that's so tough. And this felt almost innovative. I can't really think of another word for it.
It was absolutely amazing. The support has been incredible. No, when the team decided on a cooperative was the model they were going to do, and everybody was researching, was like, I don't have a clue. We don't have any role model to follow. We've got the grocery store and the electric company.
Right.
Yeah. So, and we were even talking to them. We were even talking to them. How do you run your co-op? How do you do this with this? And of course, they came from a totally different angle, and it was like, we had to figure this all out. None of us have business degrees. I mean, I have a college degree, but it wasn't business. And so you have to do QuickBooks, you have to do payroll, you have to do all this stuff. And we're just like, wow, what are we looking at doing here? This is kind of crazy. And then we were blessed with finding MCCD and Electra. And that was just like the world off my shoulder. We're like, oh my God. The support, the technical support, the learning the QuickBooks and doing all of that, it was just amazing. And just to know that we have somebody that's like, hey, what do we do with this situation? Or who can I talk to? Or sometimes we just need a pep talk.
Yeah.
It's like, you got this, just keep going. Because it's tough. It has not been an easy road, and they're not making things. That's sure.
And one of the things that I'll add about the supports is that because this kind of intentional initiative has been happening for 10, 11, 12 years, more intentional strategic supports are being built every day by virtue of what we're learning from caregivers in the field. Like I literally came to MCCD from the Cooperative Development Foundation, which is the organization that kind of started the home care initiative in partnership with the organization that hosts the national conference, right? So basically, like I started getting involved in this work, came to love it. They were like, hey, by the way, this program is happening in your own community. And I said, what do they need? And they were like, they need a person to help say no more. And because that conference has been happening year after year after year, there have been different cooperative developers, different lenders, different technical assistance providers, research organizations, social enterprise consultants, people that do anything related to direct care that come to that conference to learn from the workshops, the trainings, the experiences that happen there. And then from that, those people are going to right back to their home communities and they're building tools, right? They're building relationships, right? So one example, Cardinal and MLS just participated in this. So Washington State has about 6 or 7 home care cooperatives now because they've been building this work for a long time. And their cooperative developer is one of the loveliest people, brilliant people, and she's got a lot of experience. So right away, when MCCD started doing this work on behalf of the state of Minnesota, like we formed an advisory committee with practitioners that were awesome at this from around the country. And we said, as an organization, we need to bring together a brain trust so that when our clients have different challenges or opportunities, we're bringing together the best and brightest minds to consult with us so that we are not giving them advice that is narrow or limited to our own knowledge, right? So like that peer learning piece that you were talking about is super important. And just recently, fabulous Deborah from the Northwest Cooperative Development Center and I were talking, and I said, you know what would be super great is like these cooperatives have grown a lot. You know, some of them have new members, some of them have never met you, you know, like, what do you think about doing a training just for the Minnesota co-ops? And she was like, happy to, right? So she, from across the country, was like, let's zoom in and bring a training. And one of the things that makes that valuable, because although MCCD could have done similar training, learning from different people with different experience, different context, and having that variety, knowing that like, guess what? They don't have to come to me. And that's one of the things that I think is most beautiful about cooperatives, right? So like, just to take a pause for a second. So as you know, Susie was mentioning, Diane supported, cooperatives are a business model, the only business model that is has a set of internationally recognized values and principles. So whether you're in Japan or in Ghana or in Alaska, if you talk to folks that are cooperators about what it means to be a cooperative, there's writ large, like a broad set of ideas that come together around what that means. And one of them is, I mean, so many of them are both about preserving the integrity of like what those people coming together want to do. So while there is support, there's also the idea of, you know, self-help, self-responsibility, independence and autonomy. So I can give them ideas or I can, you know, consult with them, but ultimately it is their business. So they are free to consult with whomever they choose, get advice and supports from whoever they choose. And I don't feel any type of way about that, right? And a matter of fact, because the cooperative movement is still relatively small in you know, the States, folks that they reach out to or they talk to, they call me. And it's not to be like, hey, by the way, do you know your client? It is really like, guess what? I'm working with them too. Let's coordinate. So that the strength of support that they're getting is even stronger, right? So when they're working with, you know, financial projections with this group over here, they're working on transportation with a, you know, SBDC up in North, like we're all talking, you know, and it relieves some of the stress that they may be feeling to be like, oh man, now I have to have a meeting with Electra and give her all these updates. Some of the updates I already know because the other people that are supporting them are helping paint the picture. Because when you're a business owner, like you're carrying all of these things, you know, and being a cooperator means that as a business owner, many hands make for lighter work. You know, so these cooperative principles and values are really the bones and the people are the muscles, right, that carry the ideas forward.
Yeah. I love that because you feel that a lot in any work or any business that you need more hands. Everyone says I wear all these hats. And sometimes that just happens because of size alone. We're small, we have things to do, but to have other people around you to support you and just help make it a little lighter is so wonderful because you're all, no matter which name you may put yourself under, you're all just sharing that weight, so to speak. And it's wonderful. I want to see if anyone here has any specific questions.
I'm real familiar with co-ops, not like this, but with, co-op Light and Power.
Yeah,
You know,
right.
so I get a check every year from there. And then living in St. Cloud, I get a check every year from Stern County, you know, so I do know, you know, and then living in Silver Creek, you know, we have the board meetings, town meetings and stuff. So yeah, you know, it's not that many people, so yeah, I've always done that kind of stuff and, you know, it was fun to do and I mean, you know, the people anyway and totally different than this, you know, but still the same, you know, and it's awesome. And when David worked, because I worked for another company doing the same type of thing, but with that company, there's, you know, guidelines, there's rules, there's, you know, you can't do this, you know. And it's, and with the, when Dave got me over to tax Susie and she just went over everything, I said, I'm in. And, it's just, you feel like a family, you know, and you get along with the other people too, but it's like a one-on-one thing instead of as a group, you know, where other people know and you just pick up and talk to somebody about something and, oh yeah, that's a good idea.
Humans, rather than a hierarchy or something.
Yeah. I just say, you know, just so much more at ease and comfortable and people understand and I mean, you can talk to anybody, you know, you've got things going on. I've fallen apart in front of them. You know, you know, so.
And probably in a way that felt like it was safe to do it, whereas in another type of agency environment, it, you know, you have to hold it together and hold your breath and, you know, steal through the day.
Yeah, you know, and then to have to go from the mood that you're, you know, what you're going through and shut that up and deal with clients, you know, and, you know, go be happier on them and say, you have to be positive, Ron. But yeah, this is what I'm here to do.
Yeah. Thank you for doing it.
And, you know, another thing, then I've been planning, I mean, I grew up in the country and, you know, my kids and I have lived different places, just in Minnesota, but, went back to my place out in the country and I even had a new house built and, my son he's 44 now, and then my daughter's 38. So a lot of difference between their graduation. I was at the time licensed in insurance, working for State Farm first in Egan, and then I got hired in 2 hours. I just went to, when I moved back, just went to social services to clean houses for people. You know, I did that, and then other people did it in St. Paul, even I grew up and had our own business doing that too. And I've worked at GAC in Night River. You give people showers, teach math, help them cook, you know, doing so many different things. And I was in a major accident in '94. I mean, I'm just disabled forever, and you know, it was a TBI, and you know, I can even relate to the dementia thing because mine just happened to be in the memory part. So then I remember after, well, my kids and I even had to live with my folks for 4.5 months. Once I got out of the hospital, they had the lights like made Duluth, and it happened at lunchtime. You know, it wasn't until 11:30 that night they even said I was gonna live, I guess. So, but anyway, you know, I remember my daughter being in 2nd grade, you know, saying, Mom, I just told you that. And Corey being in 8th grade and a boy, just told you that, you know, and you know, it's forever gonna be just there and so hard and really, before you come down and it's so hard on all that and everything that I've been through my entire life has been to learn. And it's been hell, but I have learned a lot. That's what I'm here for. That's why I'm still here. My job is done. And been wanting to sell my house for years. I'm in town again after my daughter graduated. I felt abandoned after she was out. And I bought a house in town, sold my place all in the country, and been wanting to get back in the country. And you know, of course, as close to where I was as possible, and you know, looking at things with everything done, and then you know, then kind of looking at different areas and think about my kids, where you know, okay, it's convenient for them, and you know, then getting into all this, and you know, where things are needed, and looking at bigger areas, and you know, first I was looking at Ely Grammar, you know, a different place like that, and Isle, and Bovee, and you know, places, and then I started looking around Pine County and Duluth, you know, just all over, and then I think, I mean, there's that Pine County, it's small, you know, I'm not the area isn't small, but there's nothing in these little places. No, there's nothing big there. There's not people helping people. There's so many people that need it. You know, and I know Hibbing is another area, but my kids would never come out that way, you know. So,
There's another gal behind you that has a question. And
no,
I really enjoyed hearing your story. Thank you for, and it's clear that you're really dedicated to this work. And I think that this is super exciting that we have 2 cooperatives of direct care in Minnesota. And can definitely, I want to validate that experience of being a direct worker and not being valued for the work that you are doing and that meaningful experience. And one thing that, so I'm a social worker, I've been training, and I think is common among our professions is burnout. And that can also happen when your values aren't aligned with the organization you're working with. What's something that you're excited about, or what opportunities do you see in your cooperatives to kind of help workers sustain themselves and continue in the field even with its challenges? And yeah.
Oh, it's exciting things. Our team is so supportive of each other. Because this can be very lonely, work in individual people's homes, sometimes you don't even talk. Workers, it's just, you know, you're out there. But they have such a strong support system that they're constantly communicating with each other. And I know that if they can't reach me, they can talk to each other. They've got a support system. And I believe in training, that they need to be supported in doing their job and doing it to the best of their ability. If it costs money, that's too bad. They deserve to know what they're doing and to feel competent and be appreciated. So we really, really go out of our way to make sure that it's appreciated. And we're hoping to do mental health wellness, you know, things. Yeah, no problem. Anybody says I need a day off, you got it. I'll cover your people. There's no question. You don't need to bring doctor's notes. You don't need to just, you need a day, you need a day. And we respect that. Having children. But I think that team support, you know, this is a very isolating job. That team support is competitive. So as long as you've got that, and the team is excited, it's like, what kind of things we'll have a wellness day, and we'll all these things, they're coming with ideas, and we will get there as soon as we're up and running and have money, but, you know. In the meantime, there's just business.
And what I hear from that is that you're intentionally building the culture.
Yes.
No easy thing.
Yeah.
You're each other.
To be mindful.
Yeah.
Each other.
Yeah.
That's what a cooperative is. That's each other. You know, we're all intertwined and, you know, like I said, there's always gonna be issues, you know, in life.
Yeah.
But what's really neat is that we all know what we do. So it's really easy to have empathy with someone that's struggling with the target. Because we all have them, you know, and how can I help? And really help with that.
Yeah.
People still there, yeah.
They just want that.
Oh, no, do they hear that? Yeah.
Our co-op firmly believes that you need to take care of people and take care of you.
Yeah.
And that's.
Yeah.
Yeah.
Oh, thank you.
So feel free to leave if you need to get to your next room. But we are staying in here for a second session. So if you want to hang around, please do so.
Keep talking.
Yeah, we're gonna keep chatting as you leave.
Yeah.
But thank you all just for coming in and listening to the discussion, and we'll still be here.
Yeah, thank you.
Yeah.
Sorry, we're.
Like what other things?
Sorry about the delay.
Cooperatives, again, they get to decide what they prioritize.
Right, yeah.
So like, instead of being told, you need to focus your energy right here, and if you see that your caregivers need support because burnout is approaching or is a real threat, they can build that in. However, the key is first they need in order to do that.
Right.
The other cool thing is that knowing that, because the caregiver project was built by and for caregivers, there's some of that that's built in. So they're training groups of people that are cooperative owners about some of the things they need to think about. Those folks are coming back to their home communities and businesses, and they're able to say like, okay, so these are some of the things you need to look out. This is this and this is that. And then I would just say that, like, lastly, these are more resilient businesses. Because you have people who care deeply about one another, who can look to their left and their right. And again, right, like whether it's somebody needs to take family medical leave because they're not taking good care of themselves and they need some encouragement, right? Or, right, the business is having a hard period of time and instead of laying someone off, they can say, let's make a different choice. And maybe all of us will reduce our hours so that Jennifer doesn't have to do her job. And we've seen cooperatives across the country make choices just like that.
Right.
In fact, fewer cooperatives closed their doors during COVID than private agencies for those types of business.
Yeah. No, thank you. That's so interesting.
And the retention is so much higher.
Yeah.
83%.
It is half. Like caregivers stay twice as long with cooperative businesses as they do.
Great.
Don't worry, you haven't missed the thing.
Yeah.
I just had to come in.
Next talk here. Talk here. I think it's the same. Oh, okay. I was gonna go do another one, but thank you so much. And I appreciate, I really appreciate learning about what you're doing and I'm excited to hear more about what you'll do.
Here, I'll give you one of these,
Yeah, I think it aligns culturally too.
Yeah, and this is talk about different types of caregiver models. I think Susie's file was in here, but we didn't get Diane's, and so maybe it'll just trust you.
Yeah, thank you. Yeah, awesome.
well, thank you for spreading the good news.
Yeah, I love it. Thank you.
What do you do?
I am the outreach director for Macon County Care. County or throughout our states, whatever I can get my hands on, I bring. If I ever have something new, I make an announcement, this is new. I bring in a speaker once a month, like next week is I'm bringing in a pharmacist. And he's gonna talk about his role as part of the healthcare team. I've actually had him do it one other time, and he is so amazing. I bring a craft or an activity once a month, and then the other weeks, we just play games. But they have all of this stuff available, but I go to them, right? Wherever they're at in their community, instead of expecting everybody that might have transportation issues, maybe some physical something,
Yeah.
you know, where they can't get there, right? So I go to them.
Even with a broken foot.
Yep, not my driving foot. Yeah. So
Wow.
I'm actually transitioning to a different company right now. So I'm really sad because I really love what I do. I'm very passionate about it. Getting people the resources that they need when they need it, not when I think they need it, right? It's when they need it. And I think too much of our society thinks that, you know, oh, they'll just come get it if they need it. No, they don't. Not in our area. They do not. There is so much pride and so much prejudice, whether it's self-inflicted or from the community, that they don't. So if we go to them, it takes a lot of that pressure.
Honestly, you don't know what you don't know. So you have no idea what resources are even available to you. You know?
Yeah.
Every single day I learn about something new and like my mind is blown and I'm like,
Right. I just did it my last job, so yeah. Yeah. So,
Give a lot of that, like, cause I know two harbors,
mhm.
so rural Lake County, Upper Finland, and just very, what I've experienced is if you go out to them and to their little community or their little diner or whatever,
Yeah.
you're gonna get a lot better response, but you can advertise up the wazoo,
Yeah.
have all the resources sitting there, but they're not gonna ask for it. And it's a generational thing, I really believe. And, oftentimes cultural, you know, certain cultures are very stoic and, clannish and introverted, you know, naturally, so.
And I tell everybody when cause I give them a little packet. And I mean, it starts with something that's like the resource guide, right? And it's got a few other things in there. And I tell them, I'm not making any judgments on you. I just give this to everybody. Whether what you do with it later, that's 100% up to you. But I just give it to everybody. So they have it. I have a peace of mind that, you know, we've got these pink cards that, I don't know if you guys have them here or not. You put them on your fridge and it's for any first responder that goes into the home. It's got all your vital information on it and things like that.
It may be not.
We get them through our local triad.
Okay.
And it's got our local emergency number, and
Yeah.
it's got a space for your medications and emergency contacts and stuff like that.
File for life.
I love it.
Yep.
That's what you guys call it here?
Yeah, I think Senior Linkage Line puts them in the swag bag, so.
Okay, I'll have to.
Yeah.
They're the red ones that have the magnet on it, yep.
Yeah.
Okay. Yeah, we get ours through our local triad,
Oh, nice.
so.
Good. Yeah.
It's helpful when people fill them out, because I found that on the phone, people who serve, it's like, you have one that's off, it's blank, why is it?
Oh, do you guys have?
Yeah.
Should probably get some. They used to have them in Lake County.
Yeah.
and Just don't have anything like that anymore.
Well, I haven't gotten, we're tracking down, see if I can get some.
Yeah, some. Fill it out on your own.
The trick is to get it filled out, because I found people now, it's like, what's on your fridge, and it's empty with it.
Yeah,
Yeah.
that's actually really good feedback. Just to know that we should
Help people fill.
see people that kind of find the right people to
Yeah.
help fill them out. Because we get them, so.
Yeah.
And that's the.
I know one thing that I'm-
Yeah.
That's their, part of their job.
That's what we do.
So, I mean, if we could get some, that would be awesome.
There's a lot of times that when I'm handing them out, I will offer if they've got like maybe some kind of grip issue or a vision issue. You know what? We can just sit down and fill it out now. We can go over here while they're playing that game and fill it out.
Right. Yeah.
So,
Yeah.
I mean, it takes them asking away again.
Yeah.
Because that's what I'm running into
Yeah.
throughout my county.
Yes.
Nobody will ask, not one. And I've been in this, I guess I've only been doing this position for 1.5 years, but it's,
You know,
I haven't found anybody that is like, hey, can I have some help?
Yeah.
Mhm.
It's
There's a lot
It's
of
the pattern, it's the pattern.
Mhm.
Right.
Yeah.
a lot of times I'll use an assumption codes. Are you familiar with that?
I guess I haven't heard that terminology. Tell
So,
me more.
well, I got to thinking about, how you approach people with cares and things that maybe don't want them or think they don't need them or whatever. So, a lot of times, in my work, what I've done is an assumption close, like, I'm just talking to you, assuming that, yeah, you want this done. Like,
Okay.
oh, let me help you. Or not even help you, but just say, okay, we're ready to wash our hands, or, okay, this or that, or, you know what I mean? I try to approach it as it's just part of the natural flow that we're doing here, so, oh, okay, let's fill your card out, or, that's probably how I would do it,
Yeah. Now that you have it on the fridge.
Yeah.
fill it out.
Yeah. So, but whenever you put that, oh, let me help you, then there's a pride thing in there, that it just kind of takes away a little bit of their pride.
Mhm.
And I'm like, I'm just gonna assume that you want to do this with me. So that has helped me a lot,
Mhm.
I don't know if you want to call it manipulative or not.
Supported.
It gets I think it's supportive and it gets the job,
I think
done, and then they feel good, about it.
I think it's easier for people to say, no, thank you.
Yeah.
Than it is to say, yes, please.
Yeah.
Yes.
Yeah, because
That's
that's still,
That's true.
they can still say, oh, we don't need to do that
Yep,
today or whatever.
yep.
Well, do you want to have us go through some introductions and just give you some one-on-one information?
You get your very own presentation too.
Yeah.
Rock star today.
Yeah.
So what interests you in being here?
Part of one of the hats that I wear is I facilitate a caregiver support group. And, well, I won't anymore, but it's part of what I do, right? So just looking how to help empower them in their caregiving, right? Giving them, every month, I give them different topics to think about. Things that they can do for themselves, that self-care piece, educational materials that, whatever somebody might mention in the group, the prior, I try and find more on that. to give them. So how do I empower them more? So they can be whole while still giving part of themselves to another person, you know?
Yeah.
So
Yeah.
that's where I'm at, is, you know, just giving them that power.
Yeah. Well, too, just because I haven't ever met you in person, but I'm with the area agency on aging, so we know, you know, Aiken County Care and all the fabulous things donuts have done and
Yeah, that's
everything
me.
that Dawn done. We hear so much. I've never met you though. So just letting you know that we hear wonderful things.
Uh-oh. Well, great.
Yeah.
Great.
Yeah, I
Because
know.
now it gets back to
Just
me.
of the programming
Oh,
and how
okay.
everything is going so well and that you just sound like a fabulous person in your area. So just know that.
Are we being recorded?
This is recorded.
Okay, then
But we don't think we can stop. But yeah, so we hear fabulous things on our end of Aiken County Care and Aiken County in general and Dawn in general. So it's nice that you joined in this conversation. Part of what I do is help grow and sustain aging services. That's why we provide technical assistance to her organization right now. And this came about because another thing that we do is just find new, maybe innovative or not really heard of yet things, or things that can be replicated from one part of the state into our rural areas of the state. I don't know why I did this because they are rural. In Duluth, I still call us rural because we have one aging service provider that does like more home and community-based services.
Yeah.
So it still feels very rural in that sense. But I don't think they're technically considered rural. And so this was something that the state was like, area agencies, get on this. And we were like, okay, let's hear more, let's talk more. And so we want to share this information because it is a different type of business model than we're familiar with.
Okay.
And so, so that's what this happened today. And then we have these three wonderful people who do so many things. Okay, maybe just start with some introductions for you two, and then you can take it, the conversation, however you want. I think would be fine. Now that we've made you stay and hunker down and
Right. You're locked in.
yep.
Nice. Well, it's great to meet you. I'm Electra Skrzydlewski. I'm with the Metropolitan Consortium of Community Developers.
Okay.
So we're an economic development and affordable housing organization in the Twin Cities, but our shared ownership work is statewide. So for the better part of the last year, year and a half since I've been with MCCD, I've been supporting Diane and Susie and the development of their cooperative businesses.
Okay.
And they'll tell you a bit about that.
It's been a work in progress. Oh, I'm Diane from St. Cloud. No name tag can tell. Yeah, we decided to be a cooperative after doing some research and talking to people, and then we were fortunate enough to find the MCCD grant to support us in that. Because our team has no business training, we didn't know what we were doing. We know how to provide supports in this community, home community-based services. We know how to do that. We know how to do the 245D licensing stuff, but we had no clue on how to run a business. And so they've been providing the technical support, the training, everything. It's been absolutely amazing. So, but it's been a 2-year process. We're not quite there, but we're getting close.
Okay.
And that's 2 years waiting on DHS for licensing.
It blows my mind every time.
Okay.
Whenever you're like, why is there a provider shortage?
Yeah,
Yeah,
There you go.
Tell them.
Yeah.
and how many of them just like it's not worth it, and they just, but
Yeah.
are starting.
Thank goodness for the government, right?
Yeah.
Like a pit bull, just swimming on, they try to shake you up, but no, they're still there. Yeah.
Are you working with DHS at the state level or at your county level that you're fighting with?
Oh.
It is state, okay.
Yeah, the state level.
Okay.
And I guess I see it not so much as a fight as it is just the inefficiency of a big behemoth, which is THS. I mean, I think there's a lot of good people that work there, but the system is not efficient. And sometimes I wonder if there's little people up in these desks that just try to figure out how to make it more complicated for you as the end user. So I would love there to be maybe an opportunity for there to be an end-to-end mentorship of people in the offices and people out in the field. I think that would be eye-opening.
Well, have a chance to talk to PHS about that in June.
Oh, okay, good.
I'm so intrigued by that.
Yeah.
Yeah, and I think that could really make a difference. You have to, anyways, my name's Susie Rosette, and I'm the Cardinal Comfort Care Cooperative. And I have been working with these lovely ladies for the past year and a half. Applied for the 245D license and did receive it finally last November. So we have been serving people actually since last summer, but most of our people at that time were all private pay. So we did do some Title III with the Agency on Aging in July to September last year. We're still doing that program. It's a Title III where we were providing homemaking services for people. And I don't know where I'm going with that. What else do we need to cover? Yeah, 245D licensed providers. So we do waivers. Assist people in their homes with home health care, and we do have an emphasis on hospice just because that's where the business originated. First for my husband and I did hospice private pay for about 14 years.
Okay.
And so then we decided, after seeing the discrepancy between, people that were receiving, good care, that had money to get good care, and then people who didn't. And so we decided that we wanted to provide services to people on Medicare and Medicaid. So that's why we applied. And since then, it's just kind of morphed into this whole other wonderful experience of learning about cooperatives. I've been an entrepreneur all my life, but never really knew a cooperative other than Whole Foods Co-op and electric, power and, but this is a worker-owned cooperative. So each of our members, what we do is we hire somebody, and then at 6 months, they are asked if they're interested in becoming a member of the cooperative. And what that brings to them is profit sharing. They become a member owner, so they become an owner in the business. And a raise in pay. So they have an opportunity to grow in the cooperative, where oftentimes people in positions of like PCA or CNAs that don't have the money to go to school to finish being a nurse or what have you, have an opportunity to grow and learn. And it's just really cool to see what happens to their face when you tell them, in 6 months, you can be a business owner, and they take pride in that, and it just raises the level of care. And then that level of care that's given to the person in the community raises the level of health in the community as a whole. So I just see it as a continuum of bringing positive health to a community.
I really liked the difference in their stories. We went a little more in depth in the first session, and Susie really saw some gaps that made her think, let's try and go for this grant to start a cooperative. And then Diane was experiencing just that more, in her words, toxic environment, and her as well as others left together.
Are you talking the workplace?
Right.
Okay, okay.
Right. And so you have those two sides, how you mentioned a little bit about like, how can that caregiver just really have that support? And then, you know, Susie just seeing a need for something else. And I just like how the stories were different and how they went about it, but they found the same grant in Minnesota. And then, did you both meet for the first time at the conference?
Yeah.
Yeah.
On the way to the conference, yeah.
Yep. Went to the conference. Yep.
And so they have these two separate stories simultaneously existing, and then they have one large conference that they all gather at. And is it all types of cooperatives or just
Direct care.
yeah, direct care cooperatives, and happen to meet, and now they work alongside one another and support one another in Minnesota. So
Yep.
it was, yeah, I think that's just a great story. And, you know, there's just so many different reasons, I'm sure, why people choose to go in this type of model, and I like that.
Yeah, so I could tell you a little bit about what the model is. And
Yes.
So, you may have, right, like Susie mentioned, you may have heard of other types of cooperatives. Well, and there are different models, but the kind of big picture way of thinking about them is that it is a company that is owned and controlled by the people that use it. So in a worker cooperative model, it means that the people that are employed by the business have a pathway to owning and controlling the business. And that larger group of member owners will elect a board of directors that are charged with making decisions for the business. But everybody has the right to purchase one share if they meet eligibility requirements. And then that share entitles them a vote on key matters that affect the business. And by virtue of that participation and making that investment by purchasing a share, that person is then also entitled to reaping the benefits of that business's success through profit sharing. So when we're thinking about what it means to have a business that can empower workers, how are workers empowered at the job? In the cooperative model, workers are empowered through ownership, control, voice, and sharing a member benefit. This is the only business model in all the business models that exist that has an internationally recognized set of values and principles, where it doesn't matter if you're in Russia, Japan, Uganda, Chile. If you're a cooperator and somebody says to you, what are the cooperative values and principles, you'll have a common understanding regardless of where you are in the world. Now, most of us can't rattle them off like on the fly, but I'll share them with you, right? So like there's both like these moral and ethical values that underpin how you think about different business differently. And you might be familiar with like a number of businesses that say we're mission driven, we're values based. They can say it, right? But how are they building their business around it? Cooperatives do it in a very particular way by virtue of the values and principles that they have chosen to ascribe to, right? And because these are about businesses coming together to pool resources, knowledge, and power, they're doing together what would be very challenging to do alone. So that's super cool, right?
Yeah.
And they're coming together around self-help, self-responsibility, democracy, equality, equity, solidarity, honesty, openness, social responsibility, and caring for others, right? So those are like the kind of like philosophical ideas that are bringing people together around the table. And what's interesting is that when you're thinking, well, how do those big picture ideas affect the business? Well, that's kind of the beauty of it, is that they're designed to be these big picture ideas. So if you want to know what they look like specifically in practice, that's up to each cooperative to decide for themselves, right? So instead of being like, we value profit over people, you know, these are businesses that value different things. And then there are 7 cooperative principles that have, again, endured for many, many years across many, many different contexts. And that is open and voluntary membership, meaning that a cooperative cannot say you must be a member. It is saying we will create a pathway for you and you have the right to choose it if you want, which is great. And then the second one is democratic, control, which basically says that by virtue of making an investment in this business, whether it's a financial investment, a labor-based investment, or a combination of the two, or a time investment, that entitles you to being able to participate in decision-making. Right? So it's a one person, one member, one share, one vote system. The third one is member economic participation. That says that unlike what we think of as like a solo entrepreneur type business, folks are, again, coming together to pool resources, ideas, knowledge, and power, where they are making some degree of investment, and they're making this investment that is in exchange for a stake in the business, right? And when we think about investment, like it's not just money, right? It's your time, it's your energy. And because it is still business and there are still market forces at play, right? Whether that's labor issues or the cost of doing business or the cost of training or making payroll or navigating a labyrinth of administrative and bureaucratic stuff in your regulatory agency, you're sharing both risk and benefit, right? So you're buying in, saying, I acknowledge that like I'm stepping up to the plate to be an owner here. And if the business fails, I'm accountable for that. If the business succeeds, I benefit from that success because I contributed. And then the fourth principle is around autonomy and independence. So like for me, I'm a technical assistance provider and a supportive partner, but like I can't tell them you have to choose this in your business or you must do this or else because it's their business. So in all the decisions that they make, whether it's how they get financing or what choices they make about the color of their logo or the benefits that they offer their employees, they are not designed to be beholden to an outside actor, right? That group decides for itself, okay, there are these terms of this agreement. Do we as a group agree with the terms of that agreement? Right? That way, one person can't be like, guess what, I signed this up for this thing and like, sorry, people. And then, member education and training is another one of them. It is a core part of the cooperative identity so that you are committed to lifelong learning as a business owner, right? There's going to be areas where there are blind spots for the business or things that the business owner needs to learn and grow. And it's not just about one business owner. It's about the group growing and learning and developing new skills together, right? One person as a thread could be weak, could be broken, right? But many people coming together builds a tapestry that's strong and hard to rip, right? So the more we know, the better that works out. And then the sixth principle is apparently their favorite, cooperation among cooperatives, and they'll tell you a full story about that. And the last one is just concern for community, right? So cooperatives come together to decide what is it, in what way do we want to contribute to community? And it could be anything from we want to deliver the best in class service to we want to create a whole program where we're donating proceeds to the community, or we want to take a day off once a year and go volunteer in the community and give back. It can show up in a lot of different ways, and those ways are at the discretion of the cooperative.
Okay.
So now you know.
How is this different from, I mean, you were saying that there's still a board of directors, correct? Okay, so what is the difference between this platform or a nonprofit?
This is a business.
Well, yes.
Yeah. So
Well, it's a nonprofit.
well, it's
but-
a for-profit business.
Oh,
So
okay,
there are cooperatives that operate on a nonprofit basis.
okay,
A lot of times those are in educational services. But these folks are trying to establish a standard of living and improving the social and economic conditions for their workers. So there is a benefit to being a strong and profitable company. But what's unique about cooperatives, unlike investor-owned businesses or other types of conventional businesses, is that profitability or capital, money, is secondary to member benefit. Right?
Okay.
So like, your job is to make sure that your members have a good social and economic position. And by virtue of that, and prioritizing that, this model, if executed in a way that is intentional and strategic, will bring profits along with it. But instead of like a traditional shareholder built business, and one of the things that you tend to see in those types of like corporate models is that they are going to grow and chase money at any cost. Because they have an incentive to enrich their shareholders. Where in a cooperative, the shareholders are the workers. Right? So if they're like, you need to see 100 clients. They're gonna be like, how? No, I'm not gonna make anybody see 100 clients. That's impractical. That leads to burnout. We're not gonna do that, right? So like nobody can compel them to do a certain thing in a certain way because they're not chasing money. They're chasing stability for their workers.
Yeah, it's a whole different mindset. It takes a bit to get people to, and you know, probably Diane's group didn't have such a tough time because they had this cooperative idea before the grant came up. But it takes a little bit to go from being an employee and have always been an employee to someone that is empowered and becomes an owner. So that's like one of my biggest things. I don't want to say struggles because I don't want to see it as a struggle, but that's probably one of the biggest opportunities we have to help change people's thinking, not only about themselves, about their work, about their community, about just how they're thinking in terms of what they do on a daily basis.
Okay.
So when they're with somebody and giving them a bath, think how empowering that is. I'm an owner in this company and I am giving this person a bath, and how much dignity and care goes into that, and how much better they feel about themselves and how much more care they're probably going to be giving to their people because they're a representative of the company. You know, and I'm not going to say that happens at every instant, but the concept is what I'm trying to get across.
Okay.
Just the concept of building the dignity within the field. You know, so many of our elders are left to their own selves and have, you know, wax as thick as, you know, whatever coming out of their ears or their nose or whatever. And, you know, we get to go out and we get to help them feel a little bit better about themselves. And a lot of times, especially with dementia or some of these memory issues, you know, that isn't the first thing on their mind is their own preservation. You know, it might be the anxiety of the weather outside and they forget about eating or drinking. So those are the things, you know, when you bring your world like down into that little bubble, it really becomes real when you're working in a cooperative, I think.
Are you finding that with, I don't know, do you call them employees still then?
Yeah, they're employees with us until 6 months and then they're offered the opportunity to become a member. And I say that on purpose because somebody can continue to be an employee for us with us forever. But at 6 months, they're offered that opportunity because they, you know, we vetted them for 6 months. We know how they work. It's kind of like a big promotion. But if you knew that you were going to start your new job, right? And if you knew in 6 months that you were going to be an owner of that company, that would be quite an incentive to stay and to invest yourself in. So it's just, it's a whole different concept.
And feel probably more heard and seen and
Yeah.
valued and making
Yeah.
decisions.
You know what's really fun is in a board meeting, like in our board meeting this past Sunday, it was really great to see people that maybe hadn't spoken up before, saying, hey, what about? And just seeing how that like, see these people grow, see the employees grow. It's,
Because your voice matters.
yeah, it's your voice matters and you're collaborating with other people as peers rather than a hierarchy. It's still hard for them to see me as their peer and not their boss. But I try to, I try to address that every day. And they'll say something like, well, the company, you know what I mean? And then I'll be like, well, it's your company. And it just kind of triggers them a little bit like, oh, I guess, well, okay, it's my company, then I better get to it, you know what I mean? Like, I better change this.
Yeah.
It puts the responsibility back on the person. And then that just snowballs into just a really neat culture. I'm excited to see what's gonna happen. This whole thing.
So do you still work with grants then? Cause I heard you mention grants or because is that a supplement to your income or is that, how does that?
Yeah, so I'll just jump in there and you can add some color. But, so in communities where they didn't have a grant pool, right? Minnesota used some of their COVID relief money to create this grant to create worker-owned cooperatives in Minnesota as a part of their workforce shortage crisis intervention strategy. So historically, this wasn't a grant that was ever available in Minnesota before. It's time bound. It may or may not be something that the legislature renews with state-based funding. But in other communities where they have worker-owned cooperatives in the direct care field, those businesses got started and they didn't always have grants, right? Like one of the limitations for the start or conversion of cooperatives is always around money, right? Like these are businesses, so they have startup capital needs or they have conversion needs. And MCCD, organization that I work for, we got involved in doing shared ownership development, kind of even before this grant was available. And part of the reason why we're able to help small business owners consider this model is because for us as a technical assistance provider, we are also a CDFI, so we're a lender. And our target market, so the folks that we prioritize, are people that may have difficulties working with traditional lenders, which cooperatives typically do. Because when you go to a bank as an individual entrepreneur, they're like, okay, we're gonna run your credit. You're gonna collateralize this loan if we give it to you. So if you default on your loan, we're gonna take your house, right? When you are building a business, there are 12, 20, 245 people around the table. Is that bank really gonna run 245 credit checks? Are they gonna ask for a personal guarantee and collateral from every single person? Well, guess what? At times they have, and at other times they have just refused to work with cooperatives. And just said, we don't get it, we're not gonna do it. So lenders across the community, there are only a handful of them that lend to these types of businesses, have to build their underwriting criteria and their loan products in a way that fit this model. Because if, for example, if there is a credit need for that business, and lots of businesses have small business credit needs, to make one of many owners run the credit check, that already means that that person has more to lose than others. To ask that person to do the personal guarantee and collateralize a line of credit or a loan already means that person now has more to lose than the others. So it's not sharing risk in the way that supports the values and principles of cooperatives. So cooperative lenders or lenders that are focused on this business model tend to eliminate those things. So at MCCD, we don't run credit checks for loans. We are not for all businesses, but for cooperatives, we don't. We don't ask for personal guarantees because we understand the model, so we're not going to do anything to undermine the way that those businesses get their capital needs met. So a lot of times, the thing that grants someone ownership is meeting a certain set of eligibility criteria. It might be you work here for 6 months, maybe it's longer than that. It might be that you work a minimum of X number of hours in that window. It might mean that you have to go through this series of trainings before that. Like the cooperative itself gets to decide what its eligibility criteria is. But then upon becoming a member or having that opportunity, they invest something in the business. And it could be as low as whatever low amount the cooperative thinks is appropriate from, a lot of the co-ops that we work with, their buy-in might be something like $25. For other businesses, especially outside of the US, their membership might be thousands of dollars. But it represents a significant enough amount of commitment to say, I'm prepared to assume the responsibilities of ownership. So one of the ways you can think about how businesses get the capital to create a cooperative is that they might do a feasibility or cash flow analysis to figure out how much money do we need to start this business. And then they might set their membership share price at a level to help build the bottom of that capital base. Then they might say, we're gonna get donations, we're gonna take out loans, we're gonna apply for other small business grants. But for cooperatives, there are very few of them that are available. So it requires cooperators themselves and business developers like myself to go out and say, we need money for co-ops, right? So like right now, it has taken many years of advocacy, like really intentional strategic advocacy. And a new piece of federal legislation was just introduced called the Worker Cooperative Development and Support Act. And this bill, if passed, would create an interagency council across federal agencies for different federal agencies that interact with small business. So the SBA, the IRS, the Commerce Department would each come together and they would be charged with the task of developing programming and a structure to support worker cooperatives. Like would be a part of their mission, like a part of their charge, right? Which would be a total game changer. Second to that, it would create a pool of $60 million in loan capital that would go out to the CDFI fund so that CDFI lenders like me, which basically what a CDFI means is that they focus on people that are locked out of traditional banking. So for us, it's Black folks, Latino folks, LGBTQ plus folks, folks in rural communities, low income communities, women, veterans, right? So folks that are completely deserving of capital investments, but banks are like, no, right? So this would create a pool of resources where they could get loans that are low interest loans, which again, if you're going to a bank, you might be paying 14% interest, right? The shared ownership loans that we have available are capped at 4%, right? Because we know that when you're working with communities that have struggled to get their capital needs met, why would you charge them exorbitant prices for things that they're trying to do to make their dreams come true, right? So in some ways, grants are available, in other ways they're not, right? So like right now, both Diane and Susie have some big dreams for their businesses, and it's going to require more capital than what the grant has made available to them, right? So like we're thinking about their future and helping them assess their capital needs in a way that will get those dreams born. But those are needs that are outside the grant. And like a lot of co-ops aren't as fortunate as them to get a working capital grant as sizable as theirs was.
Yeah, we're very fortunate. So we worked hard to build a base so that we can be successful in long term. And yeah, there's just no way, I don't think that would have ever happened.
Yeah, and I think for a lot of what you're saying is like, it was, I think for you in your situation, there's probably an incentive to consider a different way of doing business than the way that you had traditionally done it, because you're like, here's the direction I want to take the way I provide care. And here's this opportunity of saying, yes, do that, but also do this. And what it was offering you was something that already resonated with the way that you were thinking and feeling about what was right for caregivers, right? And I think for you all, you had the same experience, right? Like you came from several environments, sadly, that were hard on you. And you had already decided that you had this idea to go this cooperative route, where that grant was just the cherry on the cake that said, you're going in the right direction, right? It comes at the right time.
It was a blessing.
So basically, if you know any disgruntled caregivers who need some love, there's love available in the cooperative sector.
Yeah, and one of the last questions we had was around burnout and how she felt that in past positions. I think she said she was a social worker. And what are they doing to address that? And what Diane was talking about was basically, my interpretation was, and just embedding that into the culture and just making, use each other and depend on each other and ask each other questions or help each other out. And just, it's that different structure coming in with that mindset and getting a say in how it's built from the people that will be
Affected by it.
yeah, affected by it. So what other way will you address burnout but together and,
Well, something along those same lines, I mean, kind of sideways from there, but, where we're at, we're struggling with finding
yeah.
employees, right? That's our huge downfall right now. Like, our median age for our caregivers is probably 60, if not 70, right? And so they're gonna be with us for, until an injury or until they decide they want to travel or until they have a life situation that comes up, right? And then we're out that amazing caregiver.
And even
And
that,
how do we replace them? That's our main issue right now.
and even then, how do you ensure that that person is able to retire in dignity?
Yeah.
Because if they're making low wages and didn't necessarily even have retirement available to them on the job, like it creates a perpetuation of the extraction from that work.
Yeah.
It's really funny. Kimberly had sent us the questions about like, here's some ideas we might talk about. And when I was thinking about what types of like policy supports, like what needs to change with our systems so that caregivers have everything that they need and more.
Right.
And
Their wages is part of that.
oh my gosh.
And they don't have those
I
right now.
really
We don't have those.
pages and pages
Yeah.
of ideas, because when you think about policy, right? The personal is political. So when we're thinking about what do caregivers need, it's not just about what they need. It's about what the people they're serving and the injuries that come to their communities need, so that we can make everybody whole. And like that is so much stuff, but cooperatives really help interrupt that cycle of burnout and the retention problem. We were talking about it in the other panel. Worker-owned cooperatives, like we've been collecting research for more than 10 years, and then they extend the average tenure for a caregiver by more than double. So a person, who has traditionally worked in the field will stay less than 18 months. And in a cooperative, it tends to be closer to 3 years. More than 3 years.
There's value in knowing that you're appreciating towards each other.
And value for those people being served. To know that their caregiver is well taken care of because they own the business. Right? And that I don't have to worry about whether or not I'm gonna see, Tina next week. Tina owns the business.
Right.
Tina's coming back next week.
Great. Yeah, yeah, building those relationships. And it ties all in with the aging, you know, and living well at home initiative. You know, so I would think that there is just gotta be huge support for a cooperative model to live at home. And you know what happens? What's happened to me in the past few months is people lose a spouse, right? So the next phone call I get from them is, hey, is there anything I could do to help at the cooperative? So we have established a volunteer and caregiver advisory board, and we will be using volunteers kind of like they do in a nonprofit, right? But they're calling back and saying, I really appreciated what you did and how can I help? And that is really cool. Who does that?
Co-ops.
You know? Yeah, who does that in a, you know, a for-profit business? So, yeah, cool stuff.
They feel that quality of care
Yeah,
from you, and it speaks a lot to what they're receiving.
yeah,
It makes me
It really
think of
does.
like
It
the,
really does.
they always tell, more so mom than a dad, they're like, you have to take care of yourself, or you can't take care of your kids, we have to self-care, or whatever they tell you. And it feels like that is the same for caregivers. Can't do all that hard work unless you are taken care of, but that goes beyond going home and reading your book and going home and taking a bath. It's what happens during the day when you're doing it. Are you supported? Do you have education? Are you heard? You know, if you have an idea, can you put it forward? Or, you know, all the pieces of that 8 to 10 hour day, whatever people do for shifts, you know, that's part of your daily care and how you feel as a human.
People say to me before, like, can cooperatives even make money, or, you know, can workers really be business owners? And it's this dismissive questioning, right? That like undermines, that like, it's the same thing as why caregivers leave the field, right? Is that like, you're not seen as a capable, qualified person in a sector doing important work, right? And one of the things that I love so much is, you know, Susie touched on it, but like seeing someone come alive in a different way because they're challenging themselves, they're growing, they're confronting limiting beliefs in their own selves, right? Where they're like, I don't know anything about reading a financial statement. Well, guess what? It might actually take you years to get good at it, but you're gonna get good at it, right? And it's just, it is a really kind of phenomenal thing to see the ways in which changing conditions for individual people has these ripple effects, right, across the cooperative membership. So then instead of having one person who's like, man,
Yeah.
I'm kind of, you know, a big deal, right? You're 15 people, 30 people who are now like, wow, look at what we've accomplished together. In the US, the largest worker-owned cooperative business across any sector is in home care, with 2,000 member owners in the Bronx. So like poor, working class, low-income community, right? Where the majority of those business owners are women and people of color. 2,000 of them are now owners. So when anybody across the country is talking about like what worker co-ops can do, they're talking about those bunch of badasses in New York, right? And the cool thing is that success is not isolated in New York, right? When we're talking about this worker cooperative conference for the whole direct care sector, right? Like Diane could walk up to somebody from, you know, Cooperative Home Care Associates and be like, tell me more about this. And guess what? Cooperators are such wonderful and generous people that they will tell you, right? So those folks are now helping to build the tools and the systems that will help grow the sector and help make sure that Susie's and Diane's and their colleagues and their cooperatives have some additional support so that when they run into some of those things, they don't want to tear their hair out. They're like that. There's a tool for that. Built by and for folks in your field.
And I heard something quite a while ago now that really sticks with me is you're the expert of your own experience. And I just love that. And that's what it is, because what better people to contribute to the growth than those who are going through it and experiencing it and doing it, and that level of that peer support, like we kept bringing up before, it's like, that's what you need. That's how you know how you can keep growing, and not just a level at the top saying, I think it should go this direction because I had only that one singular idea to do it that way.
And coming from being my own boss for years, this has made me grow in so many ways, because I used to be able to make a decision like this and that, right? Oh, well, this came along, I'm like, okay, let's do that, or not do that.
Yeah.
And in a cooperative, you can't do that.
Yeah.
You have to go to the board, have to present it in front of the board and get everybody else's ideas. And I love it.
Yeah.
I love it. So good. Look at you. Did you win something?
No, I just got it.
Where did that come from?
Well, I ended up in what the fire department one. We should, walk and it's a little spatula and.
Oh my God, how cute.
I didn't know.
And that was it. I don't know.
Awesome.
Yeah.
Thank you.
Well, thank you, ladies. This was really informative. There's been, for a number of years in Aiken, I have been trying to get an adult daycare, for lack of a better term.
Oh, yeah.
I had everything in order, and then my personal life fell apart, so I kind of dropped everything and stepped back.